Currently in the United States, tobacco use accounts for $96 billion in direct medical expenses each year. Over the past decade, using some of the concepts developed by the Centers for Disease Control and Prevention, the Southern Nevada Health District has developed and implemented a nationally recognized tobacco control program. Oversight comes from our Office of Chronic Disease Prevention and Health Promotion and has the evidence to back up some pretty significant accomplishments. Decreasing youth smoking by over 50%, decreasing adult smoking by nearly 10%, expanding cessation programs to diverse population sectors disproportionately affected by smoking, and increasing public awareness of the dangers of secondhand smoke. As a result, we've been chosen by the U.S. Department of Health and Human Services to receive approximately $14.6 million as part of its Communities Putting Prevention to Work program. Funded by federal stimulus dollars, it is a one-time grant to be used solely for the Clark County Tobacco Prevention Enhancement Project over a 2-year period. And we're proud to say this grant, awarded to the team headed by the Health District, is one of only 44 given to communities nationwide.
This is huge. As we know, the state legislature has had to take funding away from every governmental agency in this state, and that has a huge impact on programs, on jobs. We've seen it all across Clark County, even in Mesquite. We've lost people this year, and that's the first time. This grant makes a huge difference because the programs that have been proven, statistically proven to work, can continue and be successful. Jobs are preserved. That we may not be able to create more jobs, but the current jobs are preserved, and that's so important in this economy.
This is not an ongoing funding source. This is for a 2-year period. Once that 2-year period is over and the activities are complete, unless some other grant program or other sources of fund come along, then many of these activities probably will cease. There are some activities that still may get integrated into routine activities through our partners and through the health district. But even when it does end in 2 years, the benefits still will be seen for many years after the grant is over.
Dr. Sands mentioned our partners, and that's one of the key elements of this project. Of the roughly $14 million grant, more than 84% will go to fund their participation. So although the health district will provide expertise, oversight, and guidance, more than 3/4 of the funding will go to help the Southern Nevada community at large.
The program has been successful over the years, even before this grant, is because of the investment that this health district has made with building partnerships in our community. And I think that's probably one of the reasons why we were so successful in our competitive application, because I think when I read the application, that's the first thing that jumped out to me was just the strength of our partnerships, the diversity of our partnerships, and that these partnerships are long existing. They didn't just come together just for the purpose of the grant.
The only way to accomplish the mission that we have to accomplish with this new grant is to get the money out into the hands of our community organizations so that they can do the work that they already know how to do and are equipped to do. So without their help, we could never accomplish all of the deliverables associated with this project. They are going to be critical to getting this accomplished, and we only have 2 years to do it.
Maria Azzarelli from our Office of Chronic Disease Prevention and Health Promotion has worked tirelessly in the area of tobacco cessation for a number of years and headed the team that wrote the grant application.
We were chosen for a variety of reasons. First, it's because we could demonstrate that over the past decade, we have accomplished so much, even with the little funding that we had. So the CDC knew that we had the capacity to do this. And secondly, they saw the need that we had in this community. Because of the extreme influence of the tobacco industry here in Nevada, but especially in Clark County, the Centers for Disease Control was aware that we really needed it here. We have a large tobacco lobby, and the only way to try to attempt to combat that would be through funding of prevention and education programs, and of course cessation programs as well.
As part of the American Recovery and Reinvestment Act, and because the project reports directly to the CDC, there are strict reporting criteria governing this grant, and records of how the funds are dispersed will be public record. Southern Nevadans are the real winners when it comes to this grant award, as the Clark County Tobacco Prevention Enhancement Project allows us to support positive, sustainable health behaviors and choices to our community.
that we finally did it. We finally showed the whole country that we know what we're doing here in Clark County and that we deserve this money and we're going to do wonderful things with it.